Contraception. Hello, my name is Dr. Catherine Clifford. In this video message, I'm going to talk to you about your contraception options. In Ireland, you can get most types of contraception from your GP, that's a family doctor, or from a family planning clinic. Make sure to tell them about any medication you're on or if you're breastfeeding, as this will help them decide which contraception options are best for you. Most types of contraception are available with a medical card. You may have to try out more than one method until you find what suits you. Remember, no method is completely effective, but some types are much better at preventing pregnancy than others. Implants, coils, and injections. First, let's talk about methods that don't depend on you remembering to take them or to use them each time you have sex. There are 4 types of contraception which you can have fitted or given every few months or years, so you don't need to remember to take them daily. These include the contraceptive implant, where a small flexible rod is inserted under the skin in the woman's arm by a doctor. This lasts for 3 years, but can be removed sooner and is over 99% effective. Another option is the coil, where a small plastic device is inserted into the womb by a doctor. These are hormonal or non-hormonal. They are more than 99% effective and can last for 3 to 10 years, depending on which coil you choose. Your doctor will explain the options. The contraceptive injection is given to a woman by a nurse or doctor every 12 weeks and is 99% effective. You must get each injection on when scheduled, or else it will be less effective. If you decide to stop getting the injections, it can take 6 to 12 months for your periods and fertility to return to normal. Now let's talk about the methods that depend on you remembering to take them or use them regularly each time you have sex. Hormonal pills, patches, and vaginal rings. Hormonal pills, patches, and rings give over 99% contraceptive protection if used perfectly. There is a higher risk of pregnancy if you sometimes forget to take them or if you take them after you are supposed to. Because of imperfect use, around 9 women out of every 100 using these methods will get pregnant each year. Condoms. Condoms are 98% effective in preventing pregnancies if you use them correctly every time. Some people might forget to use them or use them incorrectly. Condoms can split, slip off, or get damaged. Condoms are the only form of contraception to protect against sexually transmitted infections. Surgery. If you decide you don't want any future pregnancies, there are surgical options available for women and men. Your GP can arrange an appointment. The operation for men is called a vasectomy. This procedure can be carried out in a hospital or in a GP surgery. Female sterilisation is a surgical procedure in a hospital. Emergency contraception. Emergency pills and coils. Emergency contraception is a backup contraception you can use after having unprotected sex if you don't want to become pregnant. You might use emergency contraception because you didn't use contraception at all, or because you missed a pill, or a condom was used incorrectly. There are 2 different types of emergency contraception pill. One can be taken up to 3 days after having sex, and one up to 5 days after. The sooner you take the emergency contraception pill, the more effective it is. And if you take it early, it can be up to 99% effective in preventing pregnancy. Emergency contraception pills are available at pharmacies without a prescription and are free if you have a medical card. Another method for emergency contraception is the copper coil. The copper coil can be inserted by some GPs or at a family planning clinic up to 5 days after you had unprotected sex, or sometimes later depending on your menstrual cycle. The coil can be left in place or removed after your next period if you prefer. For more information on your contraception options, visit www.sexualwellbeing.ie. Thank you for watching.